Hi everybody, my name is Allison Yanni, and today we will be talking about decision theory in medicine. This theory will touch on four things: the Hippocratic Oath, decision theory, physician-assisted suicide, and Kevorkian versus Kant. So the first point is the Hippocratic Oath, which is an oath historically taken by physicians. It is one of the most widely known of Greek medical texts. In its original form, it requires a new physician to swear by a number of healing gods to uphold specific ethical standards. Since then, the oath has been modified numerous times. There has been a large debate on whether doctors administering or facilitating lethal injections to prisoners are breaking the Hippocratic Oath. So this leads me to my next point, which is decision theory in medicine. This is when doctors make a medical decision that would most benefit their patient. The doctor would have to take into account the probability of the patient having a particular disease, like cancer, and then they would have to administer the correct treatment based on the results of the tests, which is usually chemotherapy in the case of cancer. The final decision of treatment is always left up to the patient, especially if they have to decide between taking a risky treatment that may or may not work. Decision theory is the relationship between the doctor and the patient, which leads me into my next topic, which is physician-assisted suicide, also known as PAS. PAS involves a doctor knowingly and intentionally providing a person with the knowledge or means, or both, required to commit suicide. This practice should only be used in cases where the patient is terminally ill, and when they are suffering more living than they would be if they were to end their lives. Imagine if you were having a conversation between you and your doctor, and he told you that you have stage 4 stomach cancer, and there's nothing they can do to help you, and they have exhausted all their options. You ask him how long you have to live, and he replies, 1 month. Now, in that last month of your life, you would be in constant pain, but what if it didn't have to be that way? Dr. Jack Kevorkian believed that the answer for terminally ill patients was to end their lives, while Immanuel Kant believed that there is a right and a wrong decision regardless of the situation. Dr. Kevorkian was a medical pathologist who was born in 1928. He would go to his patients' homes, and then he would record videos of his patients expressing their wish to die. The only problem with his procedure is that he would administer the lethal dose of euthanasia himself. He released all of this information to the police and was infamously dubbed Dr. Death. Immanuel Kant was a German philosopher born in 1724, who is widely considered to be a central figure of modern philosophy. He argued that fundamental concepts structure human experience, and that reason is the source of morality. Immanuel Kant's moral theory is that there are no exceptions to right and wrong decisions, meaning that either all terminally ill patients should choose to end their lives, or all of them should try to live out the remainder of their lives. I would like to thank you for listening to my presentation, and if you have any questions, please do not hesitate to ask.